I'm ready to welcome our next speaker, guys. Our next speaker is Paul Tambeau, and he is the Chief Commercial Officer for Doctor Care Anywhere in the UK. He is Chief Commercial Officer and also Chief Transformation Officer, having joined the team in 2018, and he's responsible for the delivery of strategic initiatives and business change projects across the business, as well as leading all the business development activities for the company across Europe. Paul, over the last 2 years, led the development and launch of the Internet Hospital program with the leading UK health insurer, including the commercial negotiations for a joint venture. And so I am particularly pleased to welcome Paul to our panel, to our conference. And Paul, while the presentation is already here, will speak to us about a roadmap for leveraging digital health services to deliver a better member experience. So over to you, Paul. I will not add anything else. Thank you for joining the conference and all the best.
Marco, thank you so much for the introduction. And I also wanted to highlight as well that we have Devika Wood, who's joined us for the presentation. She's the proposition owner at AXA Health in the UK, and is one of our partners and will be joining me in the presentation. So just wanted to check that you guys could hear me okay as well.
Perfect. I can hear you, Paul, and welcome, Devika, as well.
Thank you.
Good. Yeah, thank you. And just as we were preparing these slides, and I was joking with Devika, I don't think AXA needs much of an introduction. I think everyone in this conference will know AXA and AXA Health being the UK brand and sort of a rebrand in the UK, but as part of the AXA group. But Dr. Care Anywhere, we are a virtual GP provider in the UK. We've been AXA's partner since 2016. And deliver, right now we're delivering about 23,000 consultations a month. So, and we've been working with AXA over the last 4 or 5 years and really looking at how we can sort of bring primary and secondary healthcare together in a joined up digital journey that is really delivering value for AXA members and is really putting AXA at the forefront of and leading transformational change in how care is delivered in bringing and making the member experience really, really slick. And so when we started on working on this problem a couple of years ago and building what we call the Internet Hospital, we now call it the Enhanced Diagnostic Journey in the UK. And you think about traditionally how insurers will manage claims, and as they are looking at moving from a payer of claims to a provider of and supporter of their members' health. Traditionally, in order to get a claim paid for, at least in the UK, a patient had to go to their NHS GP and get a referral letter to have a referral for AXA to pay that claim. And it creates a number of different issues in terms of how that journey then is delivered. One, from an insurer standpoint, there are some limitations there in terms of the directionality of care in terms of managing their cost. Certainly, there's a number of pathways and a number of partners that insurers work with to try and create some reduce that sort of variability. But as a patient goes in to see a specialist, there's a lot of variability in how that care is delivered, which can lead to some increasing costs. And when you bring a public system into a private system together as well, there are the public system is sometimes quite happy for an insurer to pick up the cost of a particular intervention, and it can lead to some unnecessary referrals into secondary care. And increasingly, insurers are looking for something that is unique in the market and delivers value and delivers an opportunity for them to increase market share. From a patient standpoint, in terms of these traditional journeys, there's also a number of issues when it comes to the number of in-person visits someone has to reach to get a diagnosis. So in a traditional journey, as I've described, they'd have to go to their NHS GP to get a referral letter. They would be submitting that into an insurer, and they'd have to go first see a specialist, then go to have some diagnostic tests, then go back to the specialist before they then get any onward care. So you've got about 4 or 5 visits that are happening before someone can have something done. And so that creates a lot of complexity for the patient. It creates a lot of complexity in terms of how claims are managed. And there's also a lot of unnecessary tests and interventions which lead to poor outcomes. So So that was sort of the challenge that we were set out together and working on to develop this diagnostic journey. And so this is what we've done. And this was launched about a year and a half ago, and we are still sort of working on refining it. But we've really tried to bring primary and secondary care together in the digital journey. So in this, across the 7 specialties, if someone is unwell, they can use through a web or mobile app, they could book an appointment with one of our GPs and have that 20-minute appointment. We've developed evidence-based clinical referral guidelines with AXA in terms of upskilling our GPs and enabling our GPs to order diagnostic tests if the patient presents with conditions or symptoms based on a set of criteria in terms of what would likely need a secondary care referral, but have our GPs use those evidence-based guidelines that develop some standardization as well to order diagnostic tests directly. There's a claims management process. We've built APIs with AXA to manage that claims approval and review process. And assuming that is approved, then we're able to organize those diagnostic tests for that particular patient based on a network that has been created. So the patient at this point, this is their first and only really in-person visit that they have to go through in this journey as they go and get a blood test done or an MRI. Those test results are then sent to our platform in the cloud through secure APIs, where we have a group of specialists that are looking at those test results and deciding what onward care is required. Those results then are shared with our GPs that are then will have a follow-up appointment with an individual to let them know. And at that point, the GP can based on the specialist recommendation, divert them into a number of pathways. If someone does need to go into an in-person service, then that is organized through AXA's network. But we have seen about 25 to 30% of the cases where some of those patients were able to be diverted into physio, were diverted into self-management opportunities, and sort of manage themselves. And so diverting them out of a traditional pathway. And so just to try and bring that a little bit to life, in terms of, we've got Ruth, who likes to play rugby. And traditionally, so in this case, we have Ruth who has hurt her knee playing rugby, and after a couple of days is still in quite a bit of pain and goes to book an appointment on her phone to have an appointment with one of our doctors. On that call, the GP is able to assess and sort of have Ruth kind of point the camera towards her knee and sees there is some swelling and manages or arranges an MRI scan. Within a few days, Ruth goes to that scanning center during her during her lunch break, somewhere that is very close to her office, has that done. The next day, one of our orthopedic knee surgeons is able to look at those results remotely and arrange for a same-day appointment with Ruth, with one of our GPs to kind of look at those particular results and have that organized quite quickly. So you could see sort of traditionally where it might take a couple of weeks and a number of in-person visits, really bringing that down into a digital journey and creating the interactions and the sort of integrations between AXA and our system to facilitate that member journey. I'm going to hand it over to Devika, who's going to speak a bit about in terms of what value this adds.
Thanks, Paul. Yeah, so thanks for having me. I'm really excited to kind of speak about this. It's one of our most pivotal kind of partnerships that we have. I guess it really carries on from what Samesh Chandra was saying this morning, where he was noting that insurers need to be part of the health ecosystem to meet this digital demands of the new world. And I guess this partnership really shows how we're trying to really drive towards enhancing our customer journeys with services that are connected and personalized. So the COVID pandemic, it really did kind of force us to think and do differently. And it has really shown us that we can work in this really agile way to drive these large scale changes. And AXA, kind of our goal is, it's a saying, to start with telehealth and do not end with it. So the value add of this partnership really came into its own this year. We were given an opportunity to bring telehealth to life at the start of this year. AXA rolled out the virtual GP service to all of our customers in a time when it obviously had the greatest need of all, which was a really good opportunity for us to see virtual health coming to life. We have seen a sign-up rate of 13% of all members using the service, which is actually approximately 250,000, and our 5-year goal is to increase this to 75%. So we're really focusing on kind of driving forward on getting these virtual GP service and the diagnostic pathway to our members. I'd say that our real value is twofold. So we've got supporting better health outcomes for our members, and then we've got supporting safe, effective, and efficient health and care that drives faster positive outcomes to our members. So the idea is that through delivering the virtual service, we're able to bring together clinical informatics, which are able to then identify the best practice. And more importantly, as Paul just mentioned, the real value is actually in reducing our number of inappropriate referrals that come through, and getting better, timely GP interventions, which is really pivotal to the diagnostic pathway that we've got. I think secondly, as well as kind of supporting the better patient outcomes, we're really seeing the benefit in controlling the claim costs by avoiding kind of the high cost treatments in the immediate term. As Paul mentioned, obviously trying to get people to access the diagnostics before seeing the specialist can really help with that, reducing that cost treatment. And also it gets the right care at the right time for the patients, which is kind of at the heart of this. I kind of also want to talk about the fact that we've seen a big value add in member satisfaction scores, which I think we could talk about in the next slide, but we've got this 91.4% who completed the diagnostic journeys, having a really good NPS score. And then retention of our AXA PPP members as well by providing kind of a differentiating USP, which is a massive value add when it comes to talking to our large corporates and getting our clients to take up this proposition. It's just been seen as a really amazing value add, and I can't really iterate that enough. Talking a little about the learnings, Paul, do you want to take over, or I can carry on?
Yeah, if you want to keep going, sure.
Okay. So I guess it's I mean, just from our point of view, it's been like an incredible year just to really show how agile it's actually been, bringing together this amazing virtual GP service into what is known to be quite, not an archaic, but a massive insurance company. We've seen some incredible uptake of it. So nearly 2 million members have access to the GP diagnostic service, which is a truly remarkable feat, I think, for anyone to think about. We've seen roughly around 21,000 appointments happening every month, which is actually the same equivalent to 10 NHS GP practices, which I think is phenomenal. And then 23% utilization rates of members using the service. We did offer this for free at the start of COVID, and with renewals happening, we've actually seen the clients keen to take this up, with 70% actually embedding the service as part of their PMI, which again just goes to show this is, it hasn't just been a trend through COVID. We're actually seeing that people are seeing the value in the service, which I think is brilliant. But we have been impacted by COVID. It's not all kind of, shiny. COVID has impacted the diagnostic network, which is kind of key to the diagnostic pathway. And that's for obvious reasons. Obviously, we have hospital networks that are completely under massive and increasing pressure, which has meant that our diagnostic network growth has been slower than anticipated. Totally understandable. And that does impact on obviously members having choice to go to get the diagnostic done close to them. But we're doing a lot of insight into this, and we're really trying to ramp it up now, even with COVID, and we are seeing an upward trend still, and we hope to kind of resume the maximum national coverage for our members kind of shortly. I don't know if you want to, Paul, anything to add on that?
Yeah, I think from our perspective, in terms of delivering the service as a clinical provider, I think there's been some really interesting learning, and not only one in terms of how the patient and how the AXA members have been responding to this, and seeing some, the value. We have seen people that are sort of dropping out a bit because I think people are worried about going to a hospital right at this period, and so we're very much looking at other ways in terms of in-home visits or other ways that we can sort of facilitate diagnostic tests to work up the patient before then we can sort of send them into other pathways. And I think it's also really highlighted I know there's been a lot of discussion around data, the importance of creating APIs and creating ways that are GDPR compliant for data sharing between Dr. Care Anywhere and AXA Health, so that we can really facilitate that journey, really learn from what's going on, learn from the member experience, and to really drive some of those some of those interventions and some of those cost savings that in the claims management process. And really also too, I think there's the last one to talk about is around GP engagement. We're sort of asking GPs to practice medicine in a bit of a different way. And there's a lot of GPs who are really excited by what's going on, what we're doing, and ensuring that we deliver it in a safe way. But I think that the level of engagement and training in terms of how we are changing perceptions and behaviors has been interesting.
Cool. So I think I'll touch on some future developments, which I think we're really excited about. So obviously, Paul just touched on the fact of kind of improving APIs so we can then get access to the billing claims data in real time. At the moment, obviously, lots of it can be manual processes. I think part, in fact, to do with we've launched something quickly during a time of COVID to get to a market need that was, really quite critical. So now we're trying to look forward and think about how we can make our data more real time to make it better insights. We've obviously want to have improved data coverage across the customer value chain, which is really important. Obviously, we're seeing a member coming all the way through from member joining up to AXA, then having access to propositions, doctor at hand, access, activate, going then through to GPs referrals, coming back in. It's really important that we join that up with data to make sure that customer has the best outcome and we can measure and monitor it. And again, around kind of looking at that data as a way to inform how we build out our CRGs, informing our clinical, the clinical referral guidelines, where we need to actually build the clinical referral guidelines up to actually provide better pathways and more pathways for our members, really using data in a driven kind of insight way. And yeah, into new specialities, I think it's really important to say that we've seen some really great work done in a small number of CRGs. We've still got a lot of way to go, but I think it's been a really good testing point for us to realize that, it's not good to always go out in a full, but just start small and then build out. And that's what we're doing. And it's really exciting stuff on the horizon.
I guess, Marco, just before we finish, I would just add in terms of where we are looking into the future is really also on terms of how we're bringing both virtual and in-person settings together. There's a lot of value and there's a lot of great things as a digital healthcare provider in terms of offering that convenience, but there are some natural limitations to what you can treat and do in a digital platform. And so we are looking at how do we bring in-person GP services, whether it's in a large corporate in their offices where you can have clinics where we can sort of have in-person, virtual, because in an in-person setting, you could treat a lot more, you could do a lot more things, and sort of bringing those all together in a very sort of seamless way for the patients and for AXA members, and bringing it all together. So I think that was it for today. I don't know if there's any questions.
Well, thank you very much, Paul, and thank you very much, Devika. Devika, I realized that I omitted your bio at the beginning, so I'm sorry. For the benefit of the audience, Devika is the proposition owner for Dr. Hand at AXA, and she's the previous founder of Vida, which is a tech-enabled care provider. So I just wanted to complete that for you, Devika. So Paul and Devika, thank you very much for this very compelling presentation. For me, it's particularly interesting to see such a large global player like AXA investing also in very innovative technologies, which effectively start as almost in a way corporate startups that then are embedded in a larger organization. So this follows some of the topics that we were discussing this morning about the importance of creating an ecosystem of partners, which relies not only on the core competencies of insurers, but also on a growing ecosystem of smaller specialized partners that truly add value to the customer experience and as you say, better than anybody, the member experience. It's relatively easy nowadays to focus on ensuring a flawless experience when things go wrong, meaning when we have a claim and so on. It's much more valuable and more difficult to create that seamless experience when we actually contribute to the health and well-being of members who are still active and who are not sick. And clearly yours is a very suitable, very fit example. So thank you very much, guys. Much appreciated. Again, in the interest of time, we will save questions for you for the questions and answer session at the end. So please stick around if you can. We have a next panel that's going to be super interesting, where you in turn can